Well, thank you so much, everybody. Welcome to the Rare is Global Advocate Grant webinar. Today, we will be discussing issues in the global rare disease community, and we've brought together an incredible panel of advocates to share their stories and their work. My name is Michelle Rivas. I am the Senior Manager of Communications here at Horizon Therapeutics, and I also lead the Rare Is program. The Rare Is program began as a social media campaign launched by Horizon in 2017 to elevate the voices, the faces, and the experiences of people living with rare diseases. Rare Is generates awareness, support, and education for hundreds of different disease states, and we know that every member of the rare disease community has a different experience, but Rare Is provides an opportunity for people living with rare diseases to share their uncensored truth of their journey while demonstrating the power of community. Today is Rare Disease Day, which is an opportunity for the world to come together and celebrate and raise awareness of the more than 7,000 different rare diseases that impact the nearly 400 million people worldwide. In honor of Rare Disease Day today, Horizon announced the Rare is Global Advocate Grant Program for 2023, opening applications now through March 31st. The Rare is Global Advocate Grant supports advocates who are catalysts in their individual rare disease communities, and this year, Horizon's Rare Is program will grant 50 groups a one-time $5,000 grant. In 2022, 30 grants were awarded to advocacy organizations, so the program has grown. Today, I'm honored to be joined by a group of truly inspiring individuals who are each a recipient of last year's Rare Is Global Advocate Grant to discuss the importance of addressing issues that the global rare disease community faces. With that, let's meet our participants. Please note, all thoughts and views shared during this discussion are the participants' own and do not necessarily reflect those of Horizon. Let's start with you, Nora.
Hi, thank you all for attending, and I'm very grateful that you're here today and that you take the time and that you're interested in learning about rare disease. My name is Nora Leonardi. I'm a rare disease mom and a patient advocacy group leader at AGO2. My 6-month-old daughter was the 22nd patient worldwide who was diagnosed with a novel rare neurodevelopmental disease that's called Lessel-Kreinkamp syndrome. And at diagnosis, we were told that she would be disabled and that nothing could be done. Now she's 3, she's doing well at the moment. But we did found a patient advocacy organization. So we really wanted to bring people together, affected families worldwide. We want to accelerate the development of therapeutics, and we want to educate. And last year, we also expanded our scope. So we include now the AGO1 related syndrome. Looking forward to today.
Thank you, Nora. Sarita, would you like to go next?
Absolutely. Thank you so much. I am Sarita Edwards, the CEO and president at the E.WE Foundation. We facilitate resources and support for families living with rare disease Edwards syndrome, commonly known as trisomy 18, families with medical complexities, other rare diseases, and special health needs. I'm also a parent advocate. My 5th child, Elijah, was diagnosed in utero with full trisomy 18. Like Nora, we were told that he would pass away in utero during the delivery process or shortly after birth. We are excited that Elijah will celebrate his 6th birthday in a couple of weeks. That really launched my efforts of advocacy and public policy. I look forward to the rest of the conversation. Thank you.
Thanks, Sarita. All right, Adrian, you're next.
Hello, thank you for taking your time to take part in this webinar. My name is Adrian Goretzki. I am from Poland. I am a patient with a rare disease with X-linked agammaglobulinemia, so one of the immune deficiencies. And also I am a lawyer. I'm a lawyer and I run a non-profit organization called the Healthcare Education Institute. But before this, for over a decade, I was a disease-specific patient advocate in the area of immune deficiencies. And now I have a foundation. We deal mostly with legal affairs of rare diseases in Central Eastern Europe in order to provide the access to treatment for the patients with rare diseases in Central Eastern Europe. But in February 2022, everything has changed. Russia invaded Ukraine, and we switched totally to helping Ukrainian refugees with rare diseases in finding specialized treatment in Poland and other countries of the European Union.
So, with that, let's get started. What are some of the challenges that the rare disease community faces in your country and in your community and around the world? Adrian, would you like to start us off with your insights from Poland?
Sure. I can speak about Poland, but when considering Poland, we have very common issues like other countries of our region. I mean, the former Soviet bloc countries, Central Eastern Europe. So lack of access to the newest therapies, especially gene therapies. But, well, as I said, last year changed everything. And now we feel lucky because we have an access to therapy. And I can say that the whole rare disease community in those countries, not only in Poland, but also in Slovakia, in Czech Republic, in Romania, many other countries, is committed to helping Ukrainian patients. So we are helping our patients, still doing this job, but also making sure that those Ukrainian refugees who came from Ukraine have an instant access to their life-saving therapies. So, well, we have the problem as usual, yes, and we had the problems as usual until February 2022. Now we have a bit more problems, but we are also trying to cope with them, and I believe we are doing well, both in my foundation, but also as a whole rare diseases community in Europe.
Let's turn to Nora from Switzerland.
Thanks. So yeah, I would say at the core, we parents really just want to help our children, help them maximize their potential and avoid them suffering. For us, there is no approved treatment. So you heard Adrian talking about getting access. That can be an issue. For us, there isn't none yet. We're two patient families at the moment in Switzerland. So you can imagine it's a very difficult and also an isolating journey. We have a lot of questions, and no one can answer them. So how did other children develop over time who had that disease? Did parents find any therapeutic strategies that helped their children, that helped them develop? It's really difficult to know that. And as a mom, it just really hurts to see your child struggle with simple things. I remember when my daughter was 8 months old, she tried to reach for a ball that was just in front of her, and she just couldn't get her body to move. That tears my heart out. So it's really how can you connect people and help them get to know how they can help their child. In Europe, a rare disease is defined as one that affects less than 1 in 2,000 people. Our disease, it's maybe 1 in 50,000. So it's just difficult to find someone who has expertise in your disease, or even more difficult to meet someone face to face.
Absolutely. Thank you, Nora. Sarita, what's your perspective from the United States?
I have to agree with a lot of what Adrian and Nora said. I think in the United States, as a rare community, we're facing a lot of the same challenges. We're facing access to resources and support. We're facing, challenges with clinical trials and even diverse representation in those clinical trials. I think a lot of families experience challenges with just the financial burden that comes with having a rare disease. I think there can be more opportunities for genetic counseling services and just awareness about rare diseases, which is why conversations like these are so important. I think in the U.S. we are taking strides and seeing improvements, but there is still so much work to do in the rare disease space. But I do agree with a lot of what they said. I think just across the board, there are so many challenges with access and resources and support, treatment solutions, just across the board.
Yeah, thank you, Sarita. All right, we're going to pivot a little bit to the Rare's Global Advocate Grant and talk about how the grant has supported your organization. And then would love if you can share some examples of how your work has contributed to addressing each of these challenges you've mentioned and building equity for the rare disease community. So Sarita, let's start this one off with you.
Sure. The Rare Is Global Advocate Grant has been so helpful to us as an organization. We did not think about non-English speaking families when we started our foundation. And we have received so many requests for information. And one of the things that we wanted to make sure we did was provide translational services and information for those families. That's one of the ways that we've used the grants. We're really looking at implementing a website solely devoted to Spanish for that community, because that's the greatest ask that we've had outside of English speaking families. We're looking at making sure our resources are translational in terms of how we're able to make sure they can interpret and understand the information that they're reading on our website in its English form. Other ways that we've wanted to use the grant, and we've been really, really successful, is providing self-care and mental health. We really wanted to expand our comfort care program, which is our Zebra program, and we've been able to really push self-care and mental health awareness and education. And even with our health literacy program, we're using it just across the board. We've been able to really, really utilize it to expand our reach with the services that we currently offer.
That's amazing, Sarita. I think you bring up a really great point around it's not just access to healthcare, it's also access to the information in a language that you understand and need that information in. So, really wonderful work. What about you, Adrian? How has the Global Advocate Grant impacted your organization?
So, thanks to the grant, we were able to produce a video guide for Ukrainians that is aimed for Ukrainian refugees with rare diseases, as we got in Poland over 2 million refugees from Ukraine, and among them, of course, a lot of people with rare diseases. We created such a guide. This guide consists of 5 videos. They are in Ukrainian, as we have a Ukrainian-speaking physician in our foundation. And they are about different things related to, let's say, living with a rare disease in Poland. The first one is about the general organization of the healthcare system in Poland, which is, of course, also a single-payer system like in Ukraine, but there are significant differences of the systems in different European Union countries. And also there is a video about not only how to navigate in the system, but also how to get, for example, vaccinated in Poland. For free, of course. There is also a video about social benefits for people with rare diseases, for people with disabilities, how to get this status of a person with a disability in Poland, how to get proper benefits. And also there is a video which is aimed specifically at, let's say, my old group of interest, I mean, patients with immune deficiencies, how to exactly get treatment when you have an immune deficiency, how to get an access to treatment, because as many other rare diseases, there could be no pause in the access to treatment when you've got an immune deficiency, because it's a very serious threat to patients' life. So we produced a video guide. We provided links among the whole community. We promoted those videos, and they are really helpful to the community, and we got really nice feedback from the patients. It really changed a lot in lives of those affected by the war.
Thank you, Adrian. All right, let's go to Nora now.
So our goal, as I said, is to connect people, to educate, and to find treatments. And so one of the things we did last year, we organized the first ever conference on Argonaut syndromes, and that brought together families and researchers and other stakeholders from around the globe. Our lead researcher, Professor Lessel, so the syndrome is named after him. He said it was insightful, encouraging, emotional. So it's been really important for us to foster the collaboration with researchers. We had one mother who attended, and she said it was the first time she truly felt understood. And that really gave her support beyond measure. And that's what we want to do to build those communities. And it gave us all hope that there's a better future for our children and that we can contribute to that. So now also, as we heard from Sarita, not everyone speaks English. Not everyone was able to travel to our conference. And it's not really fair that those people are then left out and don't get access to at least a little that we do know. and can get educated and find support, find this very important peer support. And so the Raris grant for us as well played a very important role to increase our reach and to make sure that what we do know and make it available in other languages and make it available in lay terms so patient families can understand it. And that really has a direct impact on their health literacy as well as on their self-care and taking care of their child. And so I really hope that our organization can continue to make an impact and contribute to drive research and raise awareness and educate across the globe.
That's wonderful, Nora. Thank you. I love all of the work that everybody is doing, but it's amazing to see how much work is being done in health literacy to make information accessible for other people, whether they're coming from Ukraine or living in, the country already and speaking a different language. So let's shift now. Why is it so important that both those who aren't a part of the rare disease community and those who are a part of the rare disease community to come together to minimize some of the concerns that you all have mentioned? What can those of folks outside of the rare disease community do to become more involved in supporting those within? Even outside of Rare Disease Day and wearing zebra stripes and lighting up for rare disease, what else can other folks do to be able to support the community? So Nora, I'd love to hear your perspective to start.
Thanks, Michelle. Yeah, I think it's a very important question. Alone, we are rare. So we really need others, the public, so we can make sure no one is left behind. And I can think of three things that people can do. So the first is around inclusion. People with rare disease are often left out. I remember when my daughter was 10 months old and we were at the playground, and at that point she couldn't sit up and she couldn't crawl. That's several months delayed for her age. And there was another mom with a 9 months old, and her son started to walk and make steps. And when he approached my daughter, the mother said, "Oh, be careful, there's a small one. Beware." And I just looked down and I hope, please don't ask me how old my child is. And so I don't know if I was more afraid of her comparison or my own. This just comparing my child and being worried that she's not going to develop and where she is. And so I think it's really try to be open-minded, not to judge, right? If you don't understand, there may be a hidden story. If you know someone, think about how you can include those people, interact with our child. Maybe you can ask us if you're unsure how to interact with our child. And that will just get us sort of out of the isolation and be part. We just, I think, all want to belong. And otherwise, it can take an impact on mental health if we start to sort of single ourselves out. The second one is just also day-to-day life. I think there was a recent survey in Europe among patients, and it showed that 40% of people spend 2 hours a day on illness-related tasks. So it can be administration, hygiene, going to treatments, traveling. So it's a lot. So if you can, maybe you can help someone out. Maybe you can offer to take their child out for a few hours, the affected one or the healthy one. Maybe you can send them a meal delivery, or just check in on them. Maybe you remember when you had a newborn, days were quite crazy. Sometimes for people with a chronically ill child, days are like that forever. So just helping people in their day-to-day can make a big difference. And I think the third is around giving. I mean, rare disease is rare, so there's not that many incentives to develop treatment. So for many of us, there is no treatment. And there have been quite a few advances as well in terms of treatments and new coming to life. And many of these were actually incubated. A lot of the early research is pushed by patient advocates. So if you do give, maybe just consider giving a fraction for causes that are more marginalized like ours.
Thank you, Nora. What are your thoughts, Sarita?
I agree. I agree with everything Nora said. I think people on the outside of the rare disease space, number one, they need to feel welcome, and it's okay to ask those questions. It's okay to want to understand. That's the only way that we can learn. I think one of the greatest accomplishments I feel as a mom of a rare disease child is being able to share his story to make myself comfortable, but also to make the person that I'm speaking to comfortable. And I think a lot of times we do feel that isolation and that exclusion. because we know the dynamics of having the rare disease. I think when it comes to children who are able to cross over into the school space, I think there's opportunity for our special education programs to explore what having a rare disease means in special education. It's different, for every single child. Special education services for my child who's in kindergarten is not the same as special education services for another child. We do have that extensive list of medical complexities, and so he may require something that another child may not. But all of that starts with conversation. Um, I think we have to understand that, again, alluding to what Nora said, we have to understand that a lot of our rare disease diagnoses comes with disability. It comes with a lot of other challenges. We need to talk about it more so families in the rare disease space know what resources are available. They know what support services are available. They know that services like early intervention is available. And I think a lot of times there's this expectation that families will know because they have the diagnosis, and that's not always the case. And so I think we just have to just continue to raise awareness about what rare disease is and what it means to individual families in order for us to really be impactful in helping them navigate the journey.
Thank you, Sarita. And especially, I think, navigating that journey while not feeling alone and having that support and community that you both are talking about. Great. So we'll go to Adrian now. What can those outside of the rare disease community do to become more involved and support the community?
Well, they can become volunteers. And this is something from a perspective of somebody who was a head of a nationwide, also in of the international organization, is very important. Because before the war, sorry for saying like this, but this is the reality right now here. And before the war, we were engaging volunteers from different fields in the patient association. Of course, we were in a profit organization, so we were asking different people for our help. Like, for example, we didn't have budget for PR activities, so we are asking friends who were engaged in PR agencies if they can help us. Before I finished law school, we were asking lawyers for help as well. So this is something what you can do. You can engage yourself on a free of charge basis, pro bono basis, and help patient organizations. I mean, I know that this is a bit different perspective that just Nora and Sarita described, but it's also, this is important. But from perspective of, let's say, professional patient advocate, it's also important when you run a rare disease association, because, for example, I am that rare that is just 1 for 100,000 of male births. So we are not very, this is not a big community. You can help as a person from outside, provide your expertise for the patient associations. And it was even started to be more important after the humanitarian crisis started caused by the war, when we really needed manpower as patient organizations, and we did get this support. I am really proud of the societies here in Europe, not only in Europe, but I can speak for my experiences that really helped us. I mean, there was a moment that we got more volunteers who are willing to help the families that we really needed. And when you are dealing with 10, 15 cases of patients every week, it's remarkable. Yes, we got engagement from not only from specialists in humanitarian actions, not only specialists in law, but also from medical students, medical doctors of other specialties. Everybody wanted to help, and still we are supported by them. So it was really, really important to get the support from them as volunteers. So if I can advise anything to somebody who is interested in helping people, especially people with rare diseases, think about the field that you are an expert, and think if you can help patient organization that you take care of, that you care about the case of this organization, how you can help them. If not, of course, you can donate, and it's also a great option. As Nora said, we all need funds for functioning. But if not, then think maybe your expertise is worth much more than the money that you can donate to this organization. So, from my perspective, from my experiences, this is very important help from people from the outside, and it can really make a difference, as both the example of my patient association back in the days proof, but also the example of the last year when we really needed much more manpower than usual. And I'm very proud, I'm very happy that the societies really responded to our call, and we gained a lot of dedicated volunteers.
Thank you so much, Adrian. I think you bring up such a great point. It's not just about funding sometimes. A lot of times it can be about providing your time and your talents to organizations to help, push the mission forward. So let's shift a little bit into talking about community and the role that community has in your work. I think you all have mentioned community one way or another. So would love to start with you, Adrian.
Sure. Yes, I mentioned about the community of people who are not directly linked to rare diseases, but I need to also mention about the community of patients and their caregivers. As I said, we are not a numerous population, but when you do the maths in a 40 million people country like Poland, there should be around roughly 400 people with this disease, and this is something. And this is something because you are not just one person, especially when you are fighting for access to treatment or resolving some issue with the authorities, but you are a group of patients. This is very important from a lawyer's perspective as well, from the PR perspective as well. But let me just say that, before the crisis, I wasn't proud of being patient with rare disease because, I was just born as a patient with rare disease, yes. But after this enormous crisis, I started to be really proud of being a patient with rare disease, because after the whole thing I saw during these 12 months, both working on the border, working with the patients in hospitals, with different patient associations, I am amazed how the community responded. That there is really something like a code of patient advocate, the set of ethical rules of patient advocate. And it is, and it really worked. And this is something new to me, that we were really doing our work as professionals as possible before, but this energy, this sense of unity that we encountered, it's something really new to me. Even I'm in the business for over 12 years. So now I know that I can count of patient advocates in general, let's say in every situation. This is something invaluable. So yes, I believe it's important that we build a community, because it's good to be more. It's good to have more people on board, because you are louder, you can do more. But also, now I know that there is a code of ethics, that there's a set of rules, that the people have open hearts for other people with rare diseases. They can perfectly understand each other, and they can bring help if it's needed. So, the community saved a lot of lives last year because of in times of the humanitarian crisis, that really work well.
Yeah, thank you, Adrian. It's so wonderful hearing your passion and how inspired you are by the community really coming together. That's wonderful to hear. All right, Nora, can you tell us a little bit about your organization's relationship with community?
I'm happy to. And first, I agree. It's really touching what you mentioned, Adrian, and how the community came in and how it grew. That's wonderful. I agree. So I think that's one community as well that for us is important. As you said, it's also strength in numbers, and how can you associate with others. We are rare, so are there umbrella organizations in Europe? There's Eurordis, there's national organizations. That's very important. I also find there's a beautiful community among patient group leaders, that they are very willing to share information and help each other out. So people are willing to help you when you're earlier on your journey on what did they do, what helped, what was successful for them, how did they organize an event, how did they communicate with their patients. That's wonderful. Another community that's important for us is the patients, of course. Again, about this peer support. When we started, so maybe in early 2020, we had 5 people in our Facebook group globally. Now we are 68, so still sounds small number, but there's 85 known patients. So it's that's very important for us, and it's gone very active. And we have a lot of exchanges, a lot of parents asking questions. Maybe how do you help your child when they can't fall asleep? Has someone struggled with a special diet? So really day to day helping people and knowing that you're not alone. Another community is the research community, of course. So to get to these therapeutics, to accelerate that development, we try to foster a collaborative environment and see how we can benefit from each other and how we can also get the patient community together so researchers can understand more about the disease and better understand the mechanism and how we may be able to approach it with a therapeutic. And then hopefully in the future, there will be another community that's also including industry. So right now, because we are a quite recent disease, for us, the focus is really on how can we lay the basics, how can we de-risk our disease. And so again, it's, I think, really the strengths as well, and on what Adrian said earlier about volunteering and how can we get expertise into our cause and how can we collaborate to together drive and make progress.
Yeah, that collaboration, Nora, is so important. Sarita, what about your work?
I'm going to jump on the collaboration. I think as an organization, when we think about community, like Nora and Adrian, of course, we have our patient community, the folks that we actually provide the resources and support to. Um, we are always attempting to grow that community because we do want to reach as many patients as we can, and patients that are just not within our disease group of trisomy 18, but just across the board with the rare disease or special health need. But we also have a really, really huge community of partners locally and globally, other patient organizations, other groups that have the same mission alignment as we do to raise awareness about rare disease, but also help families navigate their individual journeys with the rare disease. And so we do a lot of collaboration with community organizations. Our community it makes up our school system. We do a lot of work with our local school district, providing resources and support. We continually work with them on mental health initiatives. For us, that's important because, in the rare disease space, mental health heightens, and the challenges with mental health is a lot more severe for a lot of families than just typical mental health challenges. And so we try to be the face of that within our school district. And then we have our community of supporters, people who believe in our mission and help us raise awareness and push the needle about trisomy 18 and rare diseases. I think everybody has touched on the value in having those volunteers, and it's not something that always comes easy. Finding volunteers to help you just with organization work. But when you find really, really good people, man, they can really, really make up a massive community on behalf of your organization. So we're grateful to say that we do have some amazing people working with us to help us with this cause.
So powerful what happens when people come together, and like you mentioned, Sarita, coming together for members even outside of that community, whether as volunteers or just supporters, and having that conversation about how to help in the school system and other areas. That's incredibly impactful. And I hope everybody who is participating recognizes their role in community and how they can continue to support. So I wanted to shift a little bit because I do know that we probably have a lot of folks on here who are from different companies and different organizations that are outside of the world that we're experiencing in each particular rare disease community. So I wanted to see how companies or organizations can effectively and authentically, I think is the key word here, partner with the rare disease community and its allies to help drive progress. So Sarita, I would love to begin with your thoughts.
I think in order to drive progress, it starts with having conversations. I think companies um, and businesses and individuals on the outside of this space can help us move forward by initially having a conversation with us. I think that's an opportunity for us to talk about, what we're dealing with as patients, as families, but also as organizations. It's an opportunity for us to share, what we're hearing those met and unmet needs are. It's an opportunity for us to be able to explore if there may be any type of collaboration opportunities. I think I think sitting down, having conversations is what builds relationships. And I think relationships are what push progress. And so I think anybody on the outside of the space, wherever they find themselves, can be a stakeholder in this fight. And it starts with having a conversation to see how we can be impactful as a unit and working together for the rare disease community.
Adrian, is there anything you'd like to share?
Well, yes, I think so. Something which is, from my perspective, needed. Again, perspective of somebody who used to run a patient organization, is that the companies who are engaged in rare diseases, they probably should start supporting organizations not only limited to their therapeutic area. This is very important because, well, we are talking about that we are rare, we need to be united. And it's true because if you count all patients with rare diseases in Europe, it's still less than patients with cancer or patients with diabetes. But so it's also important to support not only initiatives that are limited to one therapeutic area or just the alliances as the, let's say, the higher level, but also projects that are not only specifically for this one rare disease, because by our actions, we are all changing the system as every single organization of patients with rare diseases, an alliance, a regional alliance, a continental alliance, but everybody is making a difference. So this is, well, my appeal, if I can say so, to think about the broader picture as well here and support organizations not just limited to one therapeutic area, especially if this is a very rare therapeutic area. Another thing which is important from perspective of my part of Europe, so the Central Eastern Europe, is entering the market. I mean, it's still like we are lacking some solutions in our part of Europe. So I encourage everybody to think about us and also think about Ukrainians, because there is a lot of patients from Ukraine in many different European countries, also in the US, also in Canada, that they have therapies right now, but they would like to go back to their homeland. And what's then? They also should have an option to go back to their homeland and get a treatment. So this is something very important. This is an issue probably that we need to think before the war is over, hopefully a victorious one, what to do with those patients who have the treatment right now, but perhaps there is no option to have it in Ukraine. So those are my two appeal: to think as a rare disease as a whole, not only limit yourself to one therapeutic area, but on the other hand, also think about providing an access to treatment, not only think about the price, also about the accessibility, and in the end, but last but not least, think about Ukrainian patients.
Yeah, thank you, Adrian. It goes back to something you said earlier, really thinking about this approach when looking at things from building equity and having equity for everybody in the rare disease community. So no matter where you're located, you're still having the same opportunities as everybody else in the community. So Nora, I'd love to have your perspective on this as well.
So yeah, I agree with what Adrian said, and Horizon had a great example with their various grant. And for us small groups, it really means the world. Every dollar counts. It's really impactful. paying a family gas to go to a conference, translating a fact sheet you can give to your therapist in your language, and also operating support so we can actually keep making an impact. And if you're a pharmaceutical company, I think there's more things that you can do specifically in that area. One, I think, is regulation. I think we need still better incentives to develop drugs, so we can actually get more drugs for rare disease. Is there any way to make it cheaper? How can we get drug development costs down? Can we get earlier conditional approval? Is there something we can innovate on the manufacturing side? Can we reuse things from other diseases? So can we go across rare diseases, so we can just reach more rare diseases? And also for us, it's really important, how can we de-risk our disease? So that's again the conversation, and having that conversation Sarita mentioned. So for us, it's really important what is it that you need, that we can do to make our disease more attractive, where around patient data collection, etc. There's also consortiums, pre-competitive consortiums, for example, around biomarkers. That's another area where we really need your expertise. So yeah, just a couple of ideas of how companies can help in that space.
What progress and advancements, education, what do you see addressing the needs of the rare disease community that you've been really excited in recent years, whether it's at your own organization or another organization that you've partnered with or just really admire? So Nora, let's go back to you to start.
Thanks. So you probably know that statistics are that about 90% of rare disease don't have a treatment. I'm a biomedical engineer by training, so I'm really excited about just in general all of the progress in genetic therapies. Most rare diseases have a genetic cause, so it means many proteins are not druggable, or it's difficult to drug them. So it means we have new targets at the DNA level, at the mRNA level. So I'm just really excited about progress that has been made there, about several treatments reaching the market. I think we all know spinal muscular atrophy. Angelman syndrome has progressed into further phases. Progeria, which is a super rare disease, they have 200 known children. They had success with drug repurposing, so that's not genetic therapy. But in general, I'm excited about the prospect of more treatments reaching the patients and making a difference to their lives and transforming patients' lives.
What about you, Sarita? What are you excited about?
I'm excited. I'm excited about the advancements in treatment solutions for sure. I think we all celebrate when another rare disease starts the conversation of repurposing or drug development of any kind. So we always celebrate a disease group making it to that point. But I'm also excited about conversations about the financial cost of what it takes to develop these drugs. Because the more we talk about it, the more we raise awareness about how that can impact a family's ability to get those drugs. I'm excited that we are talking more about self-care and mental health, and why these are conversations that we need to have more often than we probably are. We're talking about it a lot more now, but we want to get to the place to where we're moving away from it being buzzwords, and we're actually exploring how do we help families in these instances. I'm excited, that as an organization we continue to impact families' lives, but also continue to build our community. That's just another word that means so much, I think, to patient organizations. I think Nora said earlier, being able to share ideas and have conversations about what's working for your organization, and exploring if that's something that may work for ours. And so I'm really excited about just continuing to build relationships and just drive the conversation to more folks in and outside of the rare disease community. I'm excited about the momentum that seems to be present in the rare disease space that I didn't feel when I first crossed over into this journey. So I'm just really, really excited that so many other people are excited about rare disease, because the more folks you get excited, the more action you get to experience. So
It's exciting too that today is Rare Disease Day. So it's, everybody's talking about rare diseases today, which is really, really amazing. So, Adrian, same question for you. Have there been any recent developments in the rare disease space that you're really excited about, or any really wonderful work that you want to recognize here?
Sure. I can only echo about what Nora said about the gene therapies, of course, but I am looking at it from a broader perspective. Maybe from a perspective of a lawyer, maybe from a perspective of somebody who is also into pharmacoeconomics, that there is a chance of creating a whole system for certain diseases. Like there is a newborn screening for rare diseases in many countries, also in Europe. So we've got a possibility to diagnose the disease at the very early stage, the genetic disease. Then we have, for example, gene therapy, so we can cure this patient, or really cure, let's say, let's put it like this. So, well, from the times when I was born, when I should have been diagnosed when I was 6 months, up to 6 months old. I was diagnosed when I was 6 years old, so it's a kind of miracle that I'm still alive, because I got my treatment far too late and nearly died in the meantime. But now people with some other immune deficiencies, now they have a chance to not only be diagnosed very early, but also cured very early. And from the also from it, it's fascinating from the humanistic perspective. Yes, we are saving somebody. We are letting them live the full life afterwards. But it's also very important from the perspective of the cost effectiveness of the whole system. Yes, we are identifying this patient in the very beginning. We are providing him or her with a life-saving therapy, and also we are saving a lot of money from the taxpayers' budget. Yes, this is really also something important to me from perspective of somebody who's into the system, of the healthcare system, that we are not only have a chance to cure those patients, to select those patients and cure them, but also we, thanks to this, we have more funds to treat other patients, to invest in medicines development. I mean, the system is really getting better. And well, I am looking at this with excitement. Yes, I really cannot wait for next year's. I know the pipelines, and well, I'm just keeping my finger crossed to see more and more patients being saved like this.
Yeah, thank you, Adrian. So we're actually at our last question, which is hard to believe, but really wanted to ask what advice you would give to other organizations and rare disease advocates for continuing to move their work forward. I think you all have mentioned how difficult it can be to, be a member of the rare disease community, but being rare, I think, Sarita, is what you said, does not mean that you're alone. So, what can other organizations, do to keep that hope to propel them forward? So I'd love to hear first from you, Adrian.
Well, my advice is always the same, because I'm conducting some courses for patient advocates, for leaders of patient organizations in my region. And I'm always telling those advocates that they shouldn't be afraid to ask for help. So ask for help, because you cannot be a one-man army, especially when you have a rare disease yourself. I know what I'm talking about. Yes, I tried to be a one-man army when I was 18. And starting my journey as a patient advocate is not possible, especially if you have some limitations as a person with disability. And ask for help, because there are many people who are going to help you, but they haven't been asked. Yes, but we need to start with asking for help, asking for expertise of others, not only from, let's say, external experts like lawyers, like PR managers, but also asking other organizations for help, organizations from the similar area of medicine who are on this similar level of development or a bit higher. But well, just asking. Probably the record during the whole humanitarian crisis was a situation that for one patient, we required consultation of 5 different entities. I mean, 5 different patient organizations, umbrella one, disease-specific one, the one which was specialized in medical evacuation, and so on and so on. Yes, and in the end, we helped those patients, but without asking, we weren't able to do it. So don't be afraid to ask others for help. This is my appeal tonight.
It's a great public service announcement for everybody. Wonderful. So, Nora, do you have any words of wisdom you'd like to share with other organizations?
Yeah, I agree, of course, with Adrian that asking for help. I mean, that's you can't do it alone. Another one I would think is keep going. So there's always more to do if you're in rare disease. I don't know if you know that Chris Nikic, he's the first person with Down syndrome who completed an Ironman triathlon. And his motto was 1% better every day. So the whole idea was be consistent at what you do and improve every day. And if you keep going, then it will build up on itself and you will go very far. So I would encourage you to know that you as patient advocates, you have passion, you have focus, and you have perseverance for your cause. And few others can mirror that you have. And so believe that you can bring change and keep going.
What advice would you give, Sarita?
I am I am right there in alignment with Adrian and Nora. I think it's really, really important that advocates know, patient organizations know that you have to stay the course. In the rare disease space, everything is slow. Drug development is slow. For a lot of families, getting diagnosed is slow. And so it's easy to become discouraged when you feel like you're just running up against the wall. You're not getting answers. You're not getting support. But one thing that I've learned in this rare disease space, that it is okay to ask for help, and you will find a community of people that will be willing to help you, and they will help you push whatever your goals are. Um, in this space, you don't have to do it by yourself, unless that's something that you want to. But there is a community of people here that are willing to support whatever your missions are. Everybody doesn't want to be a public advocate. Everybody doesn't want to, be a legislative advocate for rare disease. You figure out what it is you want to do in this space with your diagnosis. You're in charge of what it looks like and what it means to you. And so I always champion rare disease families, with knowing persevere, and you decide what your rare disease journey looks like. You're in charge of that.
Thank you, Sarita. Well, I really want to thank all of these wonderful and incredible advocates for all of the work that they do to support the rare disease community. And I really hope that you'll all partake in awareness activities for Rare Disease Day today. I want to thank everybody who's joined this and go back to some words that Nora had said at the beginning around how insightful, encouraging, and emotional it is when the community really comes together. So really appreciate having this conversation and allowing this space, and just want to encourage everybody to share. You've heard from Global Advocate Grant recipients today. So if there is somebody in your community that can benefit, that you know is working to advance, educate, and address the needs of the rare disease community, let them know about this program. As I mentioned earlier, this year we're going to be providing 50 $5,000 grants to organizations around the globe. And this is really a wonderful community that's progressing forward issues in the rare disease community and making an impact. So thank you so much today for joining, and we really appreciate all of the work that you do in the rare disease community. Thank you.